You're listening to the Quint's podcast.
India administered its 1 billionth dose of the COVID-19 vaccine on 21st October, passing a major milestone for a country where just a few months ago, the Delta variant of the virus ripped through. The occasion was met with a lot of song and dance, with the centre launching a new song and an audiovisual film to mark the landmark event. Along with that, the largest national flag, weighing 1400 kgs, was hoisted at the Red Fort. Soon after the country hit the milestone, PM Modi paid a visit to Delhi's Dr. Ram Manohar Lohia hospital to interact with health workers and vaccine beneficiaries. And given the hurdles that India faced in the initial days of the vaccine drive, from vaccine shortages, distribution problems to state and private hospitals, and the deadly second wave which crippled our healthcare system for nearly 3 months, hitting 1 billion doses is no small achievement. But as India celebrates this major milestone, it is also important to remember that millions of people are still waiting to receive the vaccine. And according to official figures, we have only fully vaccinated 30% of our nearly 1.4 billion population. And this statistic does not include children under 18, who make up nearly 40% of the population. And even though 74% of the population is vaccinated with one dose, the issue of vaccine hesitancy still exists, with at least 10% of the population, according to a recent survey, not planning to take the vaccine at all. The centre also announced earlier in May that India's adult vaccine drive will be completed before December 2021. But are we on track to meet that target? What hurdles is India currently facing in our vaccination drive? And 9 months later, what lessons have we learned from them? To analyze this for today's episode, we spoke with Angela Taneja, who is the Inequality Campaign Lead at Oxfam India, and Dr. Chandrakant Laharia, an epidemiologist and a public policy expert. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. India's roadmap to reaching 1 billion doses has not been smooth. Just to give you a recap, the first hurdles began even before the inoculation started, with the centre ordering vaccines very late from Serum Institute of India, which manufactures Covishield. This resulted in a poor vaccination rate as the second wave started to build up in March. And all this time, the government was still exporting vaccines to other countries. By April end, right before the window for adults over 60 years of age and 45 plus with comorbidities being eligible for vaccines, the supplies dried up, with multiple states reporting severe shortages and some even temporarily suspending vaccine drives. And then there's also the issue of quote-unquote record-setting vaccine days and the problems which come along with it. In the past few months, this has notably happened twice. First on 21st June, when every person over the age of 18 was eligible to get the jab, and it also marked the first day when the centre would be responsible for vaccinations and not state governments. And India inoculated over 88 lakh people that day. However, cases of people who did not receive jabs but somehow had certificates to show that they did came up, particularly in Madhya Pradesh. For example, according to an NDTV report, in June this year, a 13-year-old received a vaccine certificate, even when only those above the age of 18 were eligible. Similar cases also started popping up recently on 17 September on PM Modi's birthday, with states setting a target of 2 crore doses as a quote-unquote gift to him. However, in a case in MP again, according to an NDTV report, a person who passed away 4 months ago received a certificate of being jabbed with their second dose of Covishield. Given the hurdles that we have faced so far with our vaccine drive, how hard exactly would it be to vaccinate the entire adult population before the centre's target deadline of December 2021? According to Angela Taneja, the target of fully vaccinating the population is theoretically impossible given India's declining vaccination rate.
I don't see how even theoretically we are going to meet the 100%. We are on 20% now. 20 to 200 is the clock of the 12 weeks wait dictates that we are not going to meet 100%. Even if you go by last week prediction from the IMF, the IMF predicts only 40% of Indians would get the vaccine by the deadline. So I don't think we will realistically achieve 100%. We're making a great effort. We started late, therefore we would end up being late. But as long as we're on the right track, we just have to wait a little longer to get to the to universalization.
So, where exactly are we on the roadmap to the entire adult population being vaccinated? Well, the country in the past 3 days has vaccinated more than 24 million people, with 7 million of that being jabbed in the past 24 hours. However, several experts have pointed out that India needs to jab 10 million doses every day to achieve that goal. And so far, we have only achieved that target 6 times since vaccinations opened up. The most recent was 17 September, where India administered more than 20 million people to mark Prime Minister Modi's birthday. But according to the COVID dashboard, total vaccinations week by week have been dropping ever since. And there is also the issue of rising vaccine hesitancy on getting the second dose of the COVID vaccine, given the fact that only 31% of the population has received the second jab. Sample this. A recent Hindu report states that in Telangana, the number of people who have skipped the second dose despite completing the required internal time between the doses has climbed to 36 lakhs. According to Dr. Lohia, vaccine hesitancy usually reaches the population when the 60% mark is reached, and that it is essential to target the population not getting the second jab since the first jab only offers minimal protection from the virus.
What we need to remember that there is a hesitancy always for be it COVID-19 vaccines or other traditional vaccines toward in the people to receive those vaccines. However, we also need to remember that usually these hesitancy kick in around once 60% of target population is vaccinated, and then it is always difficult to increase coverage because of the prevailing hesitancy. However, with the experience of second wave, we have seen that around 75% people have turned up, 75% of adult population has turned up to receive their vaccine, which is an indication that some of the hesitancy has gone down. That's one part. So we should appreciate, and I think this is a reason to be satisfied that a 3/4 of India's adult population, eligible adult population, has come forward to receive vaccine, COVID-19 vaccine. When it comes to the receiving second shot, what we need to remember that there is a time lag of 12 weeks between first shot and second shot. Now, we know that India's vaccination drive was struggling and there were less amount of vaccine available. So majority of vaccine supply in the system has started only late August and September onwards. So essentially, people have received their first shot. A large proportion of population has received their first shot starting September and now in October. Now they have to wait for 12 weeks before they can get second shot. So the gap we see between the fully vaccinated and first shot is because they are not hesitant, but they are waiting for their turn to come to receive the second shot. And that's the reason.
Hesitancy for getting the second dose and even registering for the vaccine also extends to rural India as well. And according to a Bloomberg report, part of the problem is the government sponsored welfare programs. The report states that the welfare programs were aiming to get at least one shot in people's arms, and benefits were attached to that single dose. However, no benefits were attached to getting the second dose, and data, whatever little is publicly available on rural vaccination rates, highlights the same. According to an Indian Express report, data from 243 backward region grant fund districts show that an average of 80% of the population from all districts were only vaccinated with the first dose, whereas only 30% of the population had the second dose. However, the report also adds that these numbers would be lower since the population numbers are based on the 2011 census. According to Angela Taneja, challenges such as the large gap between the doses, the reliance on booking a slot through a digital platform like Covin, and gender challenges become a hurdle for the rural population to be motivated to get the second dose.
So, with respect to the rural vaccinations, with respect to COVID, 4 or 5 things. It's been welcome that in the last few months, there's been a progressive push towards using frontline health workers and moving away from a pure digital only mode of registration, which has proven to be a barrier to vaccination of especially rural populations, but also urban poor as well. There still, however, are challenges with respect to rural vaccination. And again, in some ways, that goes to the question of is there hesitancy or is it something else that's holding up vaccination? One is there's a continued challenge with respect to distance, with vaccination sites remaining at a fairly long distance from from people's homes. There is still an issue with the reliability of availability of the vaccines. For example, as of yesterday, when I again did one of my once in a week checks at how is COVID availability looking like. There is no way of booking in advance more than 1 day in advance. So therefore, reliability of yes, at least you don't need to go through COVID, but at the same time, the number of doses as each center is allotted is limited. Therefore, you may go and not get the vaccine. You need to go the second time. So therefore, that sense of, yes, I would want to be vaccinated, but do I truly want to take the gamble of going to the center and maybe not getting the vaccine, or at least losing a whole day while standing in the hope of getting one? People are hesitant to lose a day's wage. Solution to that is extending the vaccination time during the day beyond 9 to 5, so that people can get themselves vaccinated before they come to work or come back, or also even in rural areas, at least you finish your day's work. In fact, in one of our recent surveys that Oxfam did, 82% of respondents were saying that they would want to have vaccination to be extended beyond 9 to 5, especially for informal sector workers and others. There still is an issue with respect to gender in terms of the fact that you're still dependent on on the permission of family members to get out of the house and stay in queue. And of course, there's also the old history of the digital divide. And we still have issues with the old and the disabled not being able to get to the centers, which are hard to get and stand in the rain and the sun. So therefore, is there hesitancy? I don't think it's as much as vaccine hesitancy as there is about the fact that yes, we may have a substantially enhanced manufacturing capacity of vaccines, but there's a gap between having vaccines manufactured and getting to those shots into people's arms.
Hitting the milestone of 1 billion doses is certainly a landmark event that should be celebrated. However, given that only 30% of the population is vaccinated, we are a long way from being completely out of the woods. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.